Over centuries, many of the major advances in public health have been achieved through medicine. Pharmaceutical interventions cure, heal, and prevent disease in the human body, as well as improve and maintain our health. As custodian of all medicines, the pharmacist is one of the most important professionals in the delivery of health services. Pharmacists are the health professionals who have the most detailed knowledge of medicines and how they work. We depend on them to ensure the safety and efficacy of the medicines used by the public. While we mostly encounter pharmacists who dispense medicines, there are many pharmacists who work behind the scenes, beginning long before the medicine reaches the patient. This change is most evident in hospitals and other institutions where the pharmacist is a key professional in the treatment of a patient. In private and public hospitals, the bedridden patient may never see the pharmacist, but every time a nurse administers medication, patients can be assured that the prescription has been evaluated and dispensed by a pharmacist. The pharmacist examines the patient chart, where the admissions nurse has recorded any allergies or conditions that require special care or indicate a warning regarding medications. With this information in mind, pharmacists in hospitals interact with nursing staff as well as with the prescribing doctors. In the public sector, some pharmacists focus primarily on medicine supply management, ordering the right medicines in the right quantities for each healthcare point so that patients can receive the medicines they need. The public sector must meet all healthcare needs of the general public. In some primary healthcare clinics, most of which are nurse-driven, the pharmacist who takes charge of medicines may not be physically present, but a qualified and registered pharmacist's assistant will be able to dispense medicines in accordance with strict document protocols and procedures that are monitored by a pharmacist. Pharmacists have been involved in developing the National Department of Health's evidence-based essential medicines list, treatment guidelines, and protocols. In public hospitals, the patient may see a pharmacist as an outpatient, and at specialized clinics, for example for TB or diabetes, the pharmacist keeps records of medicine interactions and dosages for each patient. There are also specialist pharmacists in the hospital environment, such as clinical pharmacists. These pharmacists interact with prescribers to ensure appropriate rational medicine use. Some hospital pharmacists are also involved in the interpretation of lab results, particularly for medicines where the gap between the effective dose and the safe dose is very narrow. As it becomes more and more difficult to manage and control infections in hospital, an antibiotic stewardship and infection control team, including pharmacists, examines patterns of antibiotic use and devises strategies for appropriate antibiotic and disinfectant use. There are many ways in which the pharmacist adds value to your healthcare. But as a patient, you are also pivotal in the quality of healthcare you receive. To enhance quality care, consumers can start by taking responsibility for themselves and for their health. You have a right to understand everything you need to know about your medicines. Your pharmacist can answer your questions, guide you in your pharmaceutical and health choices, and contribute to your wellness. Together, we can strive towards quality pharmaceutical care to achieve good health. Your pharmacist knows. Your pharmacist cares. Ask your pharmacist.